and to also improve the structure. By and large, the investment that came in from the COVID-19 pandemic has strengthened the health system. We have been able to improve the infrastructure, expand the network of oxygen plants, isolation centers, ICUs, laboratories, all those ones are there. The workforce development is what we're facing now, and looking for ways of getting the balance between what the state spends on training, the health workforce, and what they give back to the state in return for the training they have received for their own good.
Thank you much. I would like to call on one of our other partners who's in the room, Sept, who is here and it's joined us. If you could please just 2 minutes. I know we are late and there's a few more brief comments, but I would love to hear, if you don't mind, from you, where you see opportunity to really galvanize investment in the workforce, and what are the opportunities that we need to try to action or really act on in this moment. Thank you.
Thank you, Vanessa. Excellencies, all protocols observed. Thank you for the opportunity. I think many colleagues have spoken before me. One of the incredible opportunities that we seem to not take advantage of as much is South-South collaboration, as Minister Leah mentioned. I think over the last 2-3 decades, many of us at the diaspora on this side had galvanized the institutions we worked in to build very strong partnerships in Ethiopia, Ghana, so many other countries. I think it is high time that we now start looking into those institutions that are ahead to use them as a platform to advance South-South collaboration. I think there is incredible momentum. In fact, tomorrow we have a meeting with Africa CDC, some donors, some health ministers to really get commitment and an actual resource allocation around community health workers training. Africa CDC has been leading this effort, but the AU in 2017 had declared that we will train 2 million community health workers. Right now, if you look at Africa, of the million community health workers, only 150,000 are paid. The rest of them are mostly volunteers. So having a paid, I think we have examples. One of the things we need to do better on is looking at examples that are working and scaling them up. Ethiopia has done a fantastic job training close to 40,000 female health workers. That's your way for gender equality. That's your way for paid workforce. That is structured, that is part of the formal workforce. So we do now, I know there are so many other initiatives on implementing, but we are now working on a new initiative, trying to raise several $billion that will go into community health workers training in Africa. And we plan to do this with Africa CDC in the lead, along with other global partners. So thank you for your leadership in this space, and we look forward to continue to collaborate with you.
Thank you for your comment. I appreciate it. I would now like to ask for comment from very patient colleague and partner here, the representative from the International Federation of the Red Cross Red Crescent.
Thank you, Dr. Vanessa. I think we have gone so long. I don't want to say much. I just want to say, and as you said before, I think we should believe in action, not so much on words. I just want to say 2 initiatives we are working with Africa CDC. The first one is around risk communication and community engagement to get to 70% vaccination coverage across the continent, Africa continent. We started this program and it goes all across Africa. So I think that's concrete partnership we want to build on, so that we can reach the 70% vaccination coverage. And the second one is, I think we all heard about the need for community health workers. We have been now working together with Africa CDC next 5 years to try to train 2 million community health workers in Africa. So these are the 2 concrete actions we want to work together with Africa CDC. I don't want to take any more time. Thank you. Bye-bye.
I'm very appreciative of your call for action. I am in agreement. And if I want, there's one more comment from the floor that I would like to call for, which is from our colleagues from AFNet. And this will conclude our program after this comment, because I know many people have pressing comments. So if I could have just 2 minutes, please, from our colleague from AFNet. Is they here? Am I looking in the wrong direction? There we are. Excuse me.
Thank you very much. I think this meeting has come at a very opportune time. The African Field Epidemiology Network has been working with the Africa CDC, supporting field epidemiology capacity development. Addressing the workforce gaps in Africa and doing so in a manner to reach the critical masses very quickly, in a manner that will enable Africa to respond effectively to the various health challenges would require a revolutionary approach. It will require an approach that allows for sustained expansion in the training capacity for health workers in the continent. But also very important is that it will require that we put in place the needed policies, but much more important, it requires that we translate these policies to allow for us to address the issues, the challenges that result in the exit of health workers from the continent. I think if we can do that, if we can sustain the training and address the issues of health worker migration over the period of time, we would be in a position to have a critical mass that will enable us respond to the various health challenges. Thank you.
Thank you very much. And with that, I'd like to turn it back, please, to our lead chair.
Thank you. Thank you very much, Vanessa, and thanks to everybody for their very pertinent contributions to all the 3 sessions. Indeed, thank you for your patience. I know we are running a little bit over time. New York is still awake, so I'm sure we'll be able to get to where we need to be next. After all the discussions, I would really like to ask of the Honorable Minister from South Africa to just put it together for us in terms of a reflection in the form of a communique of all that has been discussed here today before we go into the closure. Honorable Minister, you have the floor.
Thank you very much, Honorable Chair, and thanks to all the colleagues, all the contributions. As we conclude this very rich discussion on reimagining health workforce development in Africa for Africa's health security, on this high level, on the sidelines of the 77th UN General Assembly on this date, we want to pledge to say we, African Union heads of states and government and heads of delegation participating at this special side event on reimagining health workforce development in Africa